Lovely. I'd like to introduce Heidi from England, who has multiple sclerosis. Welcome, Heidi.
Hello.
Could you tell me when you first started to notice MS symptoms?
Probably about 3 years ago.
Okay. How old were you at the time?
Probably around about 45.
And what symptoms were you experiencing?
First of all, it was my leg. Wasn't seeming to be able to walk properly. My foot sort of dragged a bit, kept tripping a bit, and then started getting sort of a weakness or sort of not so strong feeling in my arm and my leg, really. That was how it was first sort of came about.
And what did your doctor do?
Well, I went to the doctor and he sort of tested me out in the surgery, and he said, well, just to be sure, I'll send you to see a neurologist. And that's what he did, and I got an appointment at my local hospital.
Did it take you very long to be diagnosed?
Yes, I think it must have been about 2 years.
Okay. So how did you feel once you'd been told you had MS?
Well, I think I sort of tried to prepare myself for it because they kept saying that's what they thought it was. But I was sort of shocked when they actually said it. When they actually say it, it's quite a shock to you, I think. And I was sort of upset. Well, I was upset, but once I got over the initial shock, I sort of turned it around and thought, well, I'm going to get through this, and I'm not going to let it beat me.
Yeah. So how long did it take you to find LDN? How long have you been on LDN?
I think, well, actually, it was my husband found it, and I think almost straight away he went on the internet looking, and that was only probably about a month or so after I'd been diagnosed he found it, and we talked about it, and more or less sort of said, well, let's give it a go. So really, I've not been on. I think I've been on about 9 months now.
Okay. So when you first started, did you have any introductory side effects?
I did have a few headaches, but that was about it.
Okay. Did your own doctor prescribe it for you, or did you have to get it privately?
I had to get it privately.
Okay. And do you get your prescription filled from Dixon's in Glasgow?
Yes, I do.
So once you started and you had no side effects, did you notice benefits very quickly, or did it take a while?
Initially, it's slow. I think I started to sort of notice an improvement, but once I sort of got up onto a higher dose, I thought the benefits were better, and mostly I think it was the tiredness that is virtually gone now. I sort of get about and I do a lot of things in a day which I couldn't have done before taking it.
So what other symptoms has LDN helped with?
I think sort of like the feelings I get sort of the sensations and that in the arm and that, but I think that sort of helped me. I just feel so much better taking it. It's very weird. I just used to feel unwell for quite a while before I took it, but now I just feel very well. It's quite unusual, but I feel now really, apart from when I'm walking, I wouldn't know I've got it. Really, and that's how well I feel now. Some days I get up and I obviously know I'm never going to walk properly again, but I just go around some days and I can't believe how well I feel now.
So if you were to score your quality of life before LDN out of 1 to 10, what would it have been?
I would have probably say about a 5.
And what would you say it is now?
I would say 9.
Oh, that's...
So apart from the walking, really, I'm, most of the time I'm very well. Obviously, I do have sort of different. Sometimes my arm feel weak during the day, or I get all them tingling and sensations down my arm and my leg. But I can put up with that because I don't have the tiredness. So, you know, I can get on with my life now.
Mm. And I think sometimes when you feel so much better, you tend to do more than you really should do, and I think that's when you probably notice those symptoms coming back, because you might have overdone it slightly. But
I do try and sort of put in a hell of a lot in every day, and I think sometimes oh, you know, I get a bit, you know, oh, I wish that could last just a little bit longer, but I think sometimes, yes, you do overdo it, you do push yourself.
Yes. So will you be continuing to take LDN?
Yes, indeed I will.
And what would you say to other people who are contemplating trying LDN but might be a little bit scared?
Well, I'd say try it, because what have you got to lose? You know, there was no other, obviously for me, they could offer me nothing at the hospital. And I thought, well, I'm not going to sit back and, you know, let it sort of take me. I'm just going to be positive and, you know, if there's something there that may help, then try it, because you've got nothing to lose.
Mm-hmm.
You've got everything to gain.
Yes. So before we end this, Heidi, this bit will be edited out. Is there anything else you would like to say?
No, I'm just glad I found it, you know, because my life has really turned around. You know, I didn't realise, you know, some days how well I do feel now. I sometimes say to my husband, you know, if I think, you know, apart from the walking, I wouldn't know I was ill, if you know what I mean.
Yeah.
You know, I'm very sort of glad I did find it. And then this person get a chance to take it, I would take it. It might not work for everyone, but, you know, it's working for a lot of people from what you read, so, you know, you might as well give it a go.
Well, I'd like to thank you very much for sharing your story with us, Heidi.
Okay, thank you.
So that will be that. We'll get it edited